हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। रेजिस्टेंट हाइपरटेंशन इज डिफाइंड एज is the BP more than 140 90 mHg with 3 or more antihypertensive. This is the answer because the resistance hypertension is defined what as the persistently elevated blood pressure that remains above the target level despite the use of 3 or more antihypertensive medication including a diuretics at a optimal dose. The BP threshold for defining resistance hypertension is typically set more than 140 by 90 mmHg. The rationale behind the definition is that it distinguishes individuals who are truly resistant to treatment and require further evaluation and management. It indicates what a failure to achieve adequate BP control despite multiple therapeutic interventions, which may warrant additional investigation to identify and address underlying causes of the contributing factors. Next question. Hemodialysis is an indication for all the below condition except uremic encephalopathy, peripheral neuropathy is the answer because the not an immediate indication for hemodialysis is the peripheral neuropathy. Peripheral neuropathy in CKD patient develops gradually and is less likely to improve rapidly with the hemodialysis. It often requires long-term management of underlying renal disease and symptomatic treatment rather than acute dialysis. Next question. Which of the following is not a treatment option in Guillain-Barré syndrome? Steroid is not a treatment because the glucosteroid have not found to be effective in the treatment of the Guillain-Barré syndrome. And plasmapheresis is not the treatment of choice, but it is equally effective and function improvement occurs after 1 week. And IVIG, intravenous immunoglobulin, is the treatment of choice in GBS because of its ease of administration and safety profile, and ventilator support is required in severe cases of GBS. Next question. A 50-year-old chronic smoker presented with mild recurrent hemoptysis without fever or weight loss. The chest X-ray appears normal and the sputum is negative for AFP. Which of the following is the most useful diagnostic investigation? MRI, CT, fibrotic bronchoscopy and bronchography. Here the CT is the best answer because in the given scenario, a 50-year-old chronic smoker with mild recurrent hemoptysis and normal chest X-ray, CT scan computer tomography is the most useful diagnostic investigation. CT scan provides first details imaging of the lungs and can help identify further subtle abnormalities that may not be visible on a chest X-ray. It can detect a small nodule, bronchial wall thickening, or other structural changes in the lungs that could be contributed to the hemoptysis. CT scan is commonly used in the evaluation of hemoptysis, especially when the chest X-ray is normal or inclusive. Next question. Which of the factors would suggest a higher risk for the patient with TIA developing a stroke in the future according to ABCD2 scoring? Higher risk factor is the diabetes. Diabetes is the answer because the presence of diabetes indicates the higher risk of the stroke. And what is the TIA and ABCD2 score? Age if more than 60 years, then we give the 1 point. BP more than 140 by 90, then we give 1 point. And clinical feature, arm weakness 1 point, speech improvement 1 point, duration of symptoms 10 to 59 minutes 1 point, more than 60 minutes 2 point, diabetes mellitus 1 point. Max score 7 will have 22% chances of developing stroke. Next question. Which among the following is the most severe manifestation of CKD? Here the hyperkalemia is the most manifestation because the hyperkalemia refers to an elevated level of potassium in the blood. In the context of chronic kidney disease CKD, it is considered one of the most severe manifestations. As kidney function declines, the ability to the kidney to excrete potassium decreases, leading to its accumulation in the bloodstream. Electrolyte imbalance in CKD, hyperkalemia refractory to medical therapy is an indication for CKD, hypokalemia, hyperphosphatemia and hypocalcemia. Next question. Arthritis is associated with all of the below condition except rheumatoid arthritis because the arthritis also known as the anterior uveitis is inflammation of the arthritis, which is the colored part of the eye. It can occur as a result of the various underlying condition among the option provided here. The rheumatoid arthritis is not typically associated with arthritis, but conjunctiva and sclera are involved in the RA, also known as the arthritis is also known as a interior uveitis. Interior uveitis. Sarcoidosis. Sarcoidosis is a multisystemic inflammatory disorder involving more than two organs. Arthritis is a ocular manifestation in sarcoidosis. And in Beckett's disease, Beckett disease is a rare autoimmune condition characterized by recurrent oral and genital ulcer, skin lesion, and uveitis. And uveitis, including, is a well-known ocular manifestation of a Beckett disease. Ulcerative colitis is a type of the inflammatory bowel disease that primarily affects the colon and rectum, while its primary manifestation are related to the GIT system. Gastrointestinal manifestation can occur including ocular involvement, uveitis, including iritis, and can occur in patient with ulcerative colitis. That's all, and keep revising. Thank you.